In the elderly, it is better to be reassured. At any of these symptoms, do not hesitate to call a doctor. It could save a life. Signal number 1. Sharp chest pain or pressure. Chest pain is not something to brush off, especially in older age. It could be the body's way of warning you. Something is very wrong with your heart. Many people hesitate, hoping the pain will pass. But waiting can be a deadly mistake. In older adults, heart attacks often begin quietly. You may feel a tightness in your chest, like something heavy is pressing down on it. The pain might also feel burning, like severe heartburn, and it might spread to your left arm, your shoulder, your neck, your jaw, or even your back. This is what doctors call radiating pain. Often, this pain comes with other signs. Cold sweat, trouble breathing, nausea or lightheadedness, a strong sense of fear or panic for no reason, and here's what makes it even more dangerous. The pain might not be sharp. Some heart attacks feel like dull pressure. Others feel like gas or indigestion. That's why so many people, especially seniors, delay getting help. They simply don't think it's serious. But it is. If this pain lasts more than 5 to 10 minutes or comes and goes in waves, it's a red flag. If it doesn't get better when you sit or rest, or if it gets worse when you're not moving, that's not normal. That's not just age. That could be your heart in trouble. Here's what you should do right away. Call emergency services. Don't wait, don't ask a neighbor, don't try to drive yourself. Call. Tell the dispatcher you might be having a heart attack. That speeds things up. If you're not allergic, chew one aspirin. It helps thin your blood. If a doctor has prescribed it before, take nitroglycerin under your tongue. Sit in a comfortable position, keep calm, and don't lie down flat. Stay still. Why is this even more important in old age? As we age, our blood vessels become less flexible and the heart works harder. But at the same time, warning signs become harder to recognize. Many older adults don't feel the classic crushing chest pain. Instead, they may just feel weak, dizzy, or short of breath. Women especially may experience symptoms differently, sometimes no chest pain at all, just nausea, fatigue, or a strange feeling of unease. Don't make these common mistakes. Don't wait to see if it gets better. Don't take regular painkillers, they can hide the symptoms. Don't assume it's just stress or something. Your body is speaking. When chest pain or pressure comes suddenly and doesn't stop, get help immediately. It's better to be wrong and safe than to be right too late. Signal number 2. Sudden numbness in the arm, leg, or face. If you suddenly feel numbness in your arm, leg, or face, especially on just one side of the body, you need medical help immediately. This is one of the most common signs of a stroke. And with a stroke, every minute matters. The faster you act, the better the chances for recovery. Here's what to look out for. Numbness or tingling in one arm or leg, weakness in one side of the body. You try to lift your arm, and it won't move. A drooping or uneven smile, slurred or confused speech, sudden difficulty understanding words. Try this quick test, it's called FAST. F face. Ask the person to smile. Does one side droop? A arms. Ask them to raise both arms. Does one drift down? S speech. Is their speech slurred or strange? T time. If you see any of these signs, it's time to call emergency services immediately. A stroke happens when the blood supply to part of the brain is blocked or when a blood vessel bursts. That part of the brain starts dying quickly, and the longer you wait, the more brain cells are lost. It can take just minutes for permanent damage to occur. Older adults are especially at risk, especially those with high blood pressure, heart problems, diabetes, or a history of smoking. But strokes can happen to anyone, even without warning. Don't ignore it. If your hand suddenly feels heavy or hard to control, your leg gives out or drags when you walk, your speech sounds slow or strange, even if you feel fine, your face feels numb, or you can't smile normally, some people experience a mini stroke, a transient ischemic attack, or TIA. The symptoms are the same, but they go away after a few minutes. Many people think, it's over, so I'm fine. But a TIA is a major warning sign. It means a full stroke could come next. Treat it like an emergency every time. What should you do if you notice these signs in yourself or someone else? Call emergency services immediately. Do not wait to see if it passes. Note the time the symptoms started. This helps doctors choose the right treatment. Keep the person calm and seated. Don't give them food, drink, or medication. Why time matters so much. There's a short window, usually about 3 to 4.5 hours, where doctors can give powerful treatments to break up clots and restore blood flow. But if you wait too long, those options disappear. Acting fast can be the difference between full recovery and permanent disability. Don't drive yourself to the hospital. Always call for professional help. Stroke treatment begins the moment help arrives. And don't assume it's something else. Many people confuse stroke symptoms with fatigue, stress, or even low blood sugar. But if numbness, slurred speech, or weakness comes on suddenly, treat it like a stroke until proven otherwise. Remember, numbness or weakness on one side of the body is a red flag. Your brain is asking for help. Don't ignore it. Don't wait. Call for emergency medical care immediately. Signal number 3. Sudden vision loss or blurred vision. Sudden changes in your vision, especially if they come out of nowhere, can be a sign of something very serious. We're not talking about normal age-related changes like needing reading glasses. We're talking about sudden blurred, dark, or partial loss of vision that may signal a stroke, a retinal problem, or another medical emergency. If you suddenly can't see clearly even in just one eye, do not wait. This could be your body warning you of a life-threatening issue. What to watch for? Sudden blurriness in one or both eyes, a gray curtain coming down over your vision, loss of part of your visual field, like not seeing objects to your left or right, double vision that appears suddenly, complete or partial blindness in one eye in older adults. The most common causes of sudden vision loss are stroke. If the part of the brain responsible for vision is affected, you might not feel any pain, but your vision can go in seconds. Retinal detachment, you might notice flashing lights, floaters, or a shadow moving across your field of vision. This requires emergency surgery. Optic nerve problems, inflammation or lack of blood flow to the optic nerve, can cause quick and painless vision loss. High blood pressure crisis, a sudden spike in blood pressure can affect blood vessels in the eye and brain, leading to vision problems. The scary part? Sudden vision loss often doesn't hurt. That's why people delay getting help. They think, maybe it'll clear up, or I just need to rest. But vision loss without pain can be just as dangerous, maybe even more, because it means people often don't act quickly enough. Important signs you should never ignore. Seeing flashes of light, sudden increase in floaters, those little specks that drift in your vision, dark spots or blind areas appearing suddenly, vision that looks like you're looking through water or fog. What to do? Call emergency services right away, especially if vision changes are sudden and severe. Do not drive yourself to the hospital. Let someone else help. Try to stay calm, avoid rubbing your eyes, and keep your head elevated. If you wear glasses, don't assume they're the problem. Sudden changes are rarely due to lenses. Why is this urgent for seniors? As we age, the risk of strokes, retinal conditions, and blood pressure issues increases. And many eye problems, if not treated in the first few hours, can lead to permanent blindness. Fast action gives doctors a chance to restore vision or at least prevent further damage. Even if the symptom passes and your vision returns to normal, it could still have been a mini stroke or warning sign. You should still be seen by a doctor the same day. Never ignore sudden vision loss. Your eyes are part of your brain. When your vision suddenly changes, your brain could be in danger too. Signal number 4. Loss of consciousness or severe dizziness, fainting, blacking out, or feeling like the world is spinning. These symptoms might seem harmless at first, especially if they pass quickly. But for older adults, they can be signs of something far more serious. Never ignore sudden loss of consciousness or strong dizziness. These are signals your body is in trouble. Let's break this down. Loss of consciousness, even for a few seconds, means your brain wasn't getting enough oxygen. That could be caused by a sudden drop in blood pressure, a heart rhythm problem, a stroke, dehydration, internal bleeding, or even a reaction to medication. If you lose consciousness while sitting or lying down, that's already serious. But if you pass out while standing or walking, you risk injury from the fall to broken hips, head trauma, and more. Now let's talk about severe dizziness. Feeling lightheaded when standing up too fast can happen. But if the room spins, if you can't walk straight, or you feel like you're about to pass out, that's not normal aging. That's a warning sign. In older adults, sudden dizziness can be linked to inner ear problems, low blood sugar, heart disease, stroke or mini-stroke, TIA, medication side effects, dehydration or anemia. So how do you know it's serious? Ask yourself. Did it come on suddenly, out of nowhere? Was there nausea, blurred vision, or confusion? Did you feel like the ground moved or the room spun? Did you fall or nearly fall? Do you feel weak or not yourself afterward? If you answer yes to any of these, it's time to seek medical help. What to do when it happens? Sit or lie down right away, don't try to push through it. If you're with someone who faints, check their breathing. If they're not breathing or unresponsive, call emergency services immediately and start CPR if trained. If they come to but still feel weak, dizzy, or confused, still call for help. Don't give them food or drink until they're fully alert. Even if the episode passes, follow up with a doctor the same day or as soon as possible. Especially if this is the first time it happened, it's getting more frequent. It was accompanied by chest pain, trouble speaking, or blurred vision. A word of caution about brushing it off. Many older people try to tough it out. I just got up too fast, or I hadn't eaten much today. Maybe. But it could also be an arrhythmia or even a mini-stroke, things you cannot see or feel until it's too late. When you lose consciousness or feel intense dizziness, your body is trying to tell you something isn't right. Listen. Don't wait for it to happen again. Don't assume it's nothing. And never, ever drive or walk alone after an episode like this until you've been cleared by a doctor. Signal number 5. Shortness of breath or trouble breathing. If you suddenly feel like you can't catch your breath, don't ignore it. Difficulty breathing is one of the body's loudest emergency alarms. Especially in older adults, this could point to heart failure, a blood clot, pneumonia, or even a heart attack. Breathing is something we do without thinking. So when it becomes difficult, it's often frightening, and for good reason. What does shortness of breath actually feel like? You're breathing faster than usual, but still not getting enough air. You feel tightness in your chest or like you're drowning in air. You can't speak full sentences without gasping. You feel panicked, sweaty, or lightheaded. You wake up at night feeling like you can't breathe. It may come on gradually or all of a sudden. But either way, it's a warning sign. Possible causes of sudden shortness of breath in older adults. Heart attack. Many heart attacks begin with breathing problems, not chest pain. Heart failure, when the heart can't pump blood efficiently, fluid backs up in the lungs. Pulmonary embolism, a blood clot in the lungs that blocks airflow, a life-threatening emergency. Pneumonia or lung infections, especially dangerous in people over 65. Chronic lung diseases like COPD, emphysema, or asthma flare-ups. Anemia. Low red blood cells mean less oxygen is delivered to the body. So when should you worry? Right away if you notice breathing getting harder without physical activity, needing to sit up just to catch your breath, swelling in your feet or legs, possible sign of heart failure, blue lips or fingertips, a sign of low oxygen, coughing up pink frothy sputum, emergency. Chest pain along with the breathing issues. What to do in the moment? Call emergency services immediately. Sit upright, not flat, to ease breathing. Try to stay calm. Panic makes it worse. Don't take food, drink, or over-the-counter meds unless told by a doctor. If you use oxygen or an inhaler, use it as directed while waiting for help. Important note. Even if you've had shortness of breath before, don't assume this time is the same. Many serious problems begin subtly and get worse quickly. Shortness of breath is often mistaken for anxiety or aging. But if it comes on fast, interrupts your daily routine, or is accompanied by other symptoms, it's not just age. It's your body calling for help. Why is this especially dangerous for seniors? Older adults often have weaker lungs, slower circulation, and a higher risk of infections. What's a mild issue for someone younger can quickly become life-threatening. Waiting too long can mean the difference between recovery and serious damage. Bottom line: if breathing becomes hard, fast, or painful, don't wait, don't guess, don't take chances. Call for help. Fast action can save your lungs, your heart, and your life.